Okay, Preclinic, this video is going to cover your Shepherd Hook Explorer. So let's review really quick. This instrument I'm holding here is a paired instrument, it's a double-sided instrument, but it's unpaired. Okay, it's unpaired because you have two different instruments on each side. So we are going to talk about the Shepherd hook, which is the side width that curves. This instrument is got a shank that's straight up and down. That makes it a simple shank. It's flexible, so that tells me that this instrument is probably an assessment instrument, which we do know our explorers are assessment instruments. This particular instrument is circular in cross section. Because it's circular, it doesn't really have cutting edges, so it doesn't really have lateral sides or faces, things like that, but it's just, circular. This instrument is something that is in a lot of the dentist kit. We keep it on our trays because the dentist will use it to check for cavities. So it's a cavity detection instrument. Let me reiterate, we do not use this one to check for calculus. But it's good to be familiar. We use it to evaluate the teeth surfaces and so forth, which is what we're going to demonstrate today. All right, so when you demonstrate this instrument, the most important concepts is that we only use about 1 to 2 millimeters of the end here. So we don't have to touch this whole working end to the tooth surface. We're really just focused on this 1 to 2 point on the tooth surface. When we use this instrument, we want to make sure when we're filling pits and grooves and fissures that we're not at a 90-degree angle, but that we're always just tilted a little bit to the side on the lateral surfaces. So on the occlusal surface, this would be 90. I don't want to come in here and push and jab at that 90-degree angle. Instead, I want to turn it to the lateral side a little bit, and I want to come in here and drag it along the grooves. Okay, so this is 90. This is what it's kind of like you're jabbing or gouging the tooth surface, whereas I want to see just on the side of that instrument, dragging it on those grooves. All right, that's the biggest part of this instrument. Now, when you guys do your process, you may use your mirror or not use your mirror. That's up to you. I want us to practice all the steps we've learned. So if I'm on the lower and I'm demonstrating this on the occlusals of the lower right, I want to set myself up in a clock position that's going to feel comfortable doing that. Now this is an occlusal surface, so it doesn't follow the exact rules we talked about with surfaces towards and away, but there's on these lower occlusals, start at your 9 o'clock and see how that feels. I want you to work on your rests, go in and land on the occlusal or incisal edge. You can use your mirror and pretend to retract, or we'll have cheeks when we process so we can retract. And you'll just demonstrate this concept. The other thing, if I'm looking at me, let's just start really quick through the steps. I'm going to come in here, I'm going to think about me. I'm kind of at a 8 o'clock position. I've got that modified pen grasp. I am going to now think about my patient. It's on the mandible, so my patient's chin is down. My patient is neutral. I'm gonna think about my equipment. I'm gonna bring my overhead light and position it at that 90-degree angle up and over my patient. Then I've got my non-dominant hand, I'm gonna retract. I've got my dominant hand with my instrument in a modified pen grasp, and I'm gonna come in here, I'm gonna land, and I'm going to demonstrate how I would assess a tooth with the Shepherd Hook Explorer. Okay, so we're gonna do this in all 4 parts of the mouth. I want you to practice that, run through those steps. Think me, my patient, my equipment, my non-dominant hand, my dominant hand, fly in and land. How would that look? You're gonna wanna be comfortable demonstrating that, and that will be your Shepherd Hook process.